And with lung cancer, survivorship is quite a contentious subject because a lot of our patients don't survive for very long. It's a very short prognosis, and I think what the project shows is that by working differently and looking at patients' problems proactively, we can improve their quality of life. We can enable them to feel empowered to cope with the rapid disease trajectory, particularly empowering their carers. And this then prevents unnecessary hospital admissions. It allows them to get involved in advanced care planning, specifying their preferred place of care and what they wish to happen at the end of their life, which is a very important part of our role to ensure that we address those issues with patients. And I think before we'd done this project, we realised although we were seeing patients regularly, we were missing key needs that patients had, and by changing the way we work, we're now identifying those and able to deal with them with patients. So I guess the different aspects are that we try and approach the patient outside of the hospital setting. So we go to home to assess them and do what's called a holistic needs assessment, so basically just looking at the patient as a whole, looking at all their needs. We also carry some of the assessments out in a GP surgery where it's a lot quieter. But the key point is to do this away from the very traumatic times within the hospital setting and along the pathway when they're finding out about diagnosis and treatment, and we're just focusing on them. So that's probably very key. The other very key element to the different way of working is doing a proactive telephone support clinic. So every week we sit down, we have a list of patients that we call, and we go through an assessment and identify any needs or concerns that they have, and we address them.